Good morning, everyone. I'm Gaurav Jajodia from Jai Balaji Endura 101. We have with us Dr. Gaurish Kenkre. He's a rehab specialist, and we all understand that it's very important to have a good rehab uh, understanding about our fitness because we all are very much into training and structured training we have already discussed and we are also working towards it. So Dr. Saab, welcome to our channel and welcome once again, and we'd just like to understand how can rehab understanding help our athletes. If you can just put some light on it, and what should be the first step for understanding a rehab properly?
Right. So, first of all, Gaurav, thank you for inviting me on your channel. It's my pleasure to be here. So, rehabilitation in India, actually, there is a lack of awareness about rehabilitation. Lot of awareness about fitness is coming in. There are a lot of trainers who are kind of working with, in fact, not just athletes, but regular people and mass is also kind of looking at fitness. And that is one good thing or a change coming in India. But again, you need to know that when you are working out with trainers or when you are working out on your own, so you should know that everybody or every person has a different individual body
Yeah.
type, and that's why every body type has to have its own path of kind of training. So you cannot do a group training. Every person is different, every individual is different, and that's where rehabilitation comes into picture.
Yes.
So if you ask me what is rehabilitation, rehabilitation has a very wide scope. So it ranges from prevention to training to recovery to therapeutic. Therapeutic means if you are injured, then there is therapeutic rehabilitation, which is one of the main course of rehabilitation. But nowadays, there is a lot of importance which is given to preventive rehabilitation, where if you don't get injured, there is you can continue with your sport or you can continue
Yeah,
with your
definitely.
activity for a
So,
longer time.
sir, with this, definitely, I like to ask, like, if in any case, athletes get injured, might be possible. So they really rush into, getting back on track and getting back on their schedule. So, what would be your suggestion be like? Because this is a very, very important part. We as athletes, we always, don't want to get injured, but in case we get very restless to get back on track.
Right. Yeah. So, because the competition is so much, if you are talking about competitive athletes nowadays, there is so much of competition that once you kind of get injured, you end up losing your place in the team. So that's why these athletes are in a rush to kind of recover faster. So when they get injured, many times they want to rush faster and they get back to kind of exercises very soon, and that's what in from our point of view creates a problem for them, because every injury needs rest period. Because
Yes.
if you want to recover from anything, you need rest. Just to give you an example of a fracture, so you everybody can connect well. When there is a bone fracture, what does the doctor do? Bones go away from each other. The
Yeah.
doctor brings the bones together and plasters it around. So
Yeah.
the plaster is just to give that rest period to that
Experience.
bones,
Yeah.
and the bones recover on their own. Basically, those bones join on their own because the rest is provided by the plaster or the
Yes.
splinting effect. Similarly, when the muscles get injured or strained, it's the same process. You need to give that rest period to the muscles. So what we do or what we prescribe normally is, when you are kind of coming out of injury, you should always do or get to isometric exercises.
Okay. 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 So, sir, can you just
Isometric
elaborate something
exercises,
on isometric exercises? Like, what is
yeah,
it like?
yeah. So isometric exercises is a exercise concept where you don't move the joint, but still you kind of end up contracting the muscles. So for an example, if you have one muscle which is sprained or torn, so the whole muscle doesn't get torn.
Okay.
It's just the fibers in the muscles. Like if one
Mm-hmm.
muscle has around 1000 fibers, the 10 or 15 fibers among those muscles are toned. So what isometric exercises does is the same concept of the plaster, what I told you.
Okay.
When you contract the muscle, the surrounding fibers end up
Mm-hmm.
having that splinting effect to those 10, 15 fibers, and
Right.
they allow them to heal. So there is no movement in the body, but you
Mm-hmm.
contract the muscle and you end up
Mm-hmm.
maintaining or increasing the strength of that muscle, and
Okay.
that fastens your recovery. So you should always get back to isometric exercises as soon as possible during your healing period of the injury,
Okay.
but don't
Okay.
do any mobility exercises.
Right. I think this will be a very, very important information given by a doctor. And so one more thing is like overtraining. Overtraining is something which, most of our athletes, end up doing more than what is required or what the body permits. So my question
Right.
is like, how can we understand what are the symptoms which comes forward and we neglect at times when we are overtraining or we have already overtrained. So what are the
Right.
symptoms we should look forward for to understand that okay, now we should at least stop, give some rest, and then again start maybe later in due course.
Right. Right. So one of the main symptoms of overtraining is fatigue.
Hmm.
The other thing is your performance levels going down. And these athletes, what happens is when their performance level goes down, they feel that the performance is going down. They train even more harder,
Even more harder,
and
yes.
that in fact troubles them more, and they end up kind of overtraining. So there is a small concept called overreaching and
Hmm.
overtraining. So you
Okay.
need to first understand when you are overreaching. So
Okay.
you kind of get a lot of fatigability in
Hmm.
between. This is completely reversible because you don't get injured in
Yeah.
overreaching. Means you are trying to kind of do repetitions, and you end up fatigue and your performance level. So you should have a baseline of your regular performance always.
Hmm.
And if that is going down, that means somewhere you are kind of training extra, which needs to come
Okay.
down. Your
Okay.
hydration is very important. Your rest periods are very important.
Hmm.
And when you can identify that overreaching, then you can prevent overtraining. So there is a
Training.
concept called overreaching. Overreaching is something where the athlete is doing extra, which is not
Hmm.
permitted by their body. And
Okay.
that is something what a trainer or a coach
Hmm.
can identify. So
Okay. Yes.
fatigability has to be kept in note. Patient's
Hmm.
mood has to be kept in note, because what happens is patients means the athlete's
The
mood,
athletes, yeah,
because
definitely.
when their performance goes down, their mood drops. So all these observations have to be done by their coach or the trainer, and they have to kind of counsel them that yeah,
Mhm.
this is something which is overreaching or overtraining, rather than you are dropping down on your performance. So that is something which needs to be a proper counseling sessions are important for these
Okay.
athletes.
Yeah. Yeah. This is really very important, and I would also like to comment on this to all our athletes that just by putting yourself into an excessively training sessions will definitely lead to injury or a very very high risk of uh, heart issue, as well as we had discussed these things in some of our last sessions. I'm sure if some viewers must have missed it, should go again and have a look as to the heart surgeon, Mr. Dr. Bose's video, which we have. So these things are really very important, not to overtrain and not to overexert. And Dr. Saab has also suggested the same. And but it's very important to understand that you are overtraining or overexerting. So this is really very tricky. It is really very tricky, but we should be having some focus on that aspect as well. So one last question, that stiffness is again a very challenging thing which which keeps on happening quite often to athletes. If they are running, their calves get very stiff and their muscles, different muscles, get very stiff in due course. So and then that leads to an injury. That's what I
Right.
understand. So if it's not
Right.
taken care properly, so what's your suggestion or some thing which our athletes can uh, consider that to?
Yes. So there
Talk
are
more about this.
two factors. One are the intrinsic factors, what the athlete has into it, means how he can control, and something from external, like your water intake is something which is very important. Maintaining the proper hydration is important. Intrinsically, your good warm up exercise is important. If you do good warm ups, you kind of make those muscles supple and flexible before you start your activity. So a good warm up, and later at the end of your training session, a good cool down
Cool down.
is very, very important to kind of, in the long run, prevent muscles from going into a lot of stiffness. Other important thing is your core muscle strength, because it's not just the stiffness because of tight muscles, but you need to find out the reason why these muscles are going into that much of tightness. So what happens is, if your core strength is weak, automatically there is over functioning or more contractions happening in these lower limb muscles, and that leads to more tightness in these muscles. So you need to prepare your core muscles very nicely. You need to strengthen your core. You need to have an active core while training. So that's very important. Also, when you are doing flexibility exercises, it's very important to know that you should not end up overstretching, because I have seen a lot of people doing stretches of hamstring where they lift the leg in the hand and then they
Yeah,
stretch.
yeah.
But that again can cause injury. So you need to make sure that when you are stretching, the stretch has to be just optimal. It should not be
Optimal.
overstretching.
Mm-hmm.
Many times you end up overstretching and you end up injuring them. So
Right.
you need to find out the reason for stiffness. You need to kind of address the other factors like core strength, inadequate core strength, your gluteal tightness, and then come to the lower limb. So
Right.
instead of directly stretching your hamstring and calf, first start proximally, stretch your gluteal muscle, stretch your piriformis muscle, and then come peripheral. That is very important.
Right. That was really very interesting to know, and even I never knew that stiffness is connected to having a very good core muscle, and you should concentrate more on core also. Obviously, we all understand core is because the name is core, so we understand that the core has to be very solid because the type of athletes whom we are addressing, they are on a regular basis. They are training and they are wanting or looking forward to achieve a lot. So once
Right.
again, I would like to thank Sir for such an informative session, and uh, I really appreciate all the informations which is given by Sir, and I'm sure our athletes will benefit with all the informations and a new look towards rehab sessions, which we all should take care of. And I thank once again, sir. And goodbye, viewers. We'll catch up once again and keep subscribing to our channel. Thank you, sir. Thank you once again.
Thank you.
Thank
Thank
you.
you.